earn. I'm just living life and I'm having a blast. No time for mistakes, cause they in the past. We're here for a reason, see we live and we learn.
Boom, what's going on, Warriors? Welcome to Boom Athletics. What I'm going to go over with you right now is a little stretch, which I use for an active stretch when I'm doing deadlifts, and sometimes with other exercises as well, depending on how my lower back feels. For the SI joint, we're going to work on the SI joint and just loosening it up a little bit. Not like you can loosen it to a great degree, but we're going to try to here. So you can use this as a passive stretch on your own. So you can use this as a passive or an active stretch, or even as a form of rehab if you've injured your SI joint. But always consult your physician before you go and do something like that. So really simple. This is a really simple form. All you're going to do here is come down and touch in between your toes. I'll move back just a tiny bit for you. So move down and touch in between the toes, just like this. Try to keep a straight spine. Sometimes if I want to stretch the spine erectus a little bit more, I'll let myself kind of curve my spine over. If I feel like I'm going to hit a little bit more of my spine erectus or up in the thoracic area and get a stretch that feels good, then sometimes I'll do that as well. But mainly if we're focusing on that SI joint, I want you to try to keep a straight spine. And the modification I started off doing on my own, even before I started really studying the SI joint, was I was doing this one coming down, and then I would come over and I would just do a hand to each side of the foot, and then back down, and then back down over here. Just trying to see basically what's going on, which side I feel a little bit more. You might feel tension through one side more than the other, which could be an indicator of a few different things. You're just going to come down through the middle. I'll show you from the side here. You can see, just going to come down, touch, back up, touch one side, back up, touch the other side, and down the middle. And again, if I want to stretch my spine erectors a little bit more and up along my spine, I'll come down and I'll actually let my back kind of curve a little bit more on these. But for the most part, let's try to stay nice and tall as we come down. And that's really how you're going to hit primarily that SI joint. And that SI joint doesn't move too much, so it's not like you're going to feel a lot of movement, but you might feel a release of tension as you do that stretch. So if you're in rehab, or if you're doing rehab, if you just got out of rehab and you didn't get to do that, you might want to add that to your routine. As long as your physical therapist says it's okay. Always see a doctor before you do any of this type of stuff if you have any type of problem with your SI joint or your back at all. And if you start to feel your lower back during any type of workout exercise, I definitely recommend adding this to your routine just to see how it feels and see if it starts to relieve some of the tension that you're feeling. Overall, if you do it on a regular basis, it might start to help as well. Anything that you do that's a rehab type of movement or exercise, you're gonna benefit from it more if you do it on a regular basis. A lot of times people get in the habit of doing, say, stuff for rotator cuff, like external rotation stuff to help their rotator cuff, or stuff for the piriformis, and they do it for a certain amount of time, and they don't realize that when those issues start to come back, it's just because they don't do it consistently. Thanks for watching, guys. Leave your comment in the comment section below.
Don't forget to stop and take a breath. I'm just living life and I'm having a blast. No time for mistakes, cause they in the past. We're here for a reason, see we live and we learn. Keep chasing your dreams, stay willing to earn. I'm just living life and I'm having a blast. No time for mistakes, cause they